Let's talk to Maggie Throup, the Vaccines Minister, who was appointed 3 weeks ago, and this is her first broadcast interview in the job. Maggie, welcome to the programme. Tell us, why do you think that Boris Johnson appointed you to succeed Nadhim Zahawi?
Well, first of all, good morning, Ian, and good morning to all your listeners. I'm delighted to be able to join you this morning. Obviously, it's an important role that I have, and I'm relishing the work I've got ahead of me. So you said that the vaccines programme is world-leading, and that is quite right. It is world-leading, and it remains world-leading. For example, 5 million people have already had their booster jab across the UK, and it continues to be rolled out successfully.
Well, that is an answer to my question. I wanted to know why you think Boris Johnson appointed you in particular to succeed Nadhim Zahawi, and what were the objectives he gave you when he appointed you?
Well, obviously, there's various objectives, but I've got a background in healthcare. In fact, I was the whip with responsibility for the Department for Health, and before that, I was the PPS, the Health Secretary, sat on the Health Select Committee, and my working life was involved in healthcare, both within the NHS. Background in this field, which does help measures that come in place as well. But as we say, the vaccine rollout is highly successful. But that's partly down to all the vaccinators come forward, and over 91 million people have come forward for their first jab, their second jab, and now are coming forward for their booster jab.
Well, the first part of the vaccination rollout was incredibly successful. I don't think anybody would deny that. But why, when that system worked and it was so successful, why was the system changed? Because now only about half of those eligible have come forward to have their booster jab. Only about 4.5 million out of 9 million people who are eligible. And if the rates continue at the present speed, they won't be done until the end of January, I believe, which rather defeats the object, doesn't it?
I think we look at different numbers. It's 4.5 million people have come forward in England, and just last week, 2 million more invitations are sent out for people to come forward. But what we're saying as well is, obviously, you've got to be eligible, which is at least 6 months after your second dose. And if you'll be getting invites from the NHS either by text or by letter. But if you haven't received your invitation after a week of becoming eligible, then please go online or dial 119 and book your jab in that way. And that's, it's so easy to get your booster, and we're encouraging everybody to do that. But it's the booster jab as well is one thing, but also there are probably about 4.7 million people who haven't yet come forward for their first jab, and some are delaying their second jab. So my plea today also is for people to protect themselves, continue to build that wall of defence, and come forward for booster, first and second jab. And also for the 12 to 15-year-olds that are eligible now for their first jab. And we've opened up the national booking service for parents to protect their children along to the vaccination centres, in addition to the school opportunity as well. There's lots of opportunities for people to get their jabs.
Well, you mentioned the 12 to 15-year-olds. The take-up in that category has been extremely slow. Do you think that's part of the reason why infection rates are now rising?
Well, the 12 to 15-year-old programme has been going for about 4 weeks now, and it's been run through the school age immunisation service that have got a vast amount of experience in this field. But we want to go quicker and faster. We've opened up the national booking service, and I think it's a really good time to do it for half term this week, when some families will have a bit more time and be able to go to the vaccination centres. It's a really good time for everybody with parental consent for the 12 to 15-year-olds to get their jab and protect themselves, and also as well.
Now, still a quarter of 18 to 29-year-olds haven't had their first jab, and a fifth of those aged between 40 to 49. What do you put that down to?
I think sometimes people feel that they're perhaps not as vulnerable as others, but as we've seen, people of all ages are vulnerable. So we'll continue to provide lots of opportunity for people to come forward for their first jab. We've been quite innovative in the way we've done it, whether it's shopping centres, sports stadia, lots of opportunities. And it's so important to do that, because we've seen that the vaccine has created our wall of defence. It's already, we estimate, prevented 24 million infections. and it's saved approximately about 130,000 lives. I mean, that's a huge amount. So I just say to everybody, come forward for your jabs when you're eligible and as soon as you're eligible. But one thing we mustn't forget...
Sorry, what are you intending to do to try and target an information campaign aimed at those groups? Because clearly, if they haven't come forward by now, they will have their own reasons, and we might think that those reasons aren't very valid ones. But unless you launch a public information campaign to those groups, I doubt whether you're going to get much more uptake.
We've done a lot with homing in on these different groups, whether it's through community leaders and going to different places. But you've probably seen that just on Friday, we launched a huge communications campaign, information campaign, to put out the message just how important the vaccines are generally. And COVID vaccines are one thing, but also we mustn't forget the flu vaccines, which help to strengthen our protection against the infection of flu. And last year it was estimated that if people got flu and COVID at the same time, they were more than twice as likely to die from that. And it's also protecting the NHS by preventing people going into hospital with, once again, a very nasty virus.
What are you doing to combat anti-vax disinformation, which is, I think, spreading across the internet in a very, very dangerous way? But I don't see anything being done by government to combat it.
I think any misinformation and false information is really, really dangerous, and it's costing lives. There's no place for that at all. I think where teachers and children have been intimidated is completely unacceptable. And my message is that ignore that. There's no place in our successful vaccine campaign for that misinformation. It's already been proven that the vaccine is safe and saves lives, and that's the big message today. Get your vaccine, protect yourself, and save lives.
Sure, and nobody's going to I say nobody's going to disagree with that. Maybe there will be some sort of mad people that do, but I want to know what the Department of Health is doing to combat this anti-vax disinformation that you can find virtually everywhere on social media now, and I don't see anything being done to combat it.
We're working all the time to look at ways to combat it and to get it removed. Obviously, I wouldn't want to reveal some of the methods that we're using, but be reassured that we take this very seriously.
Do you have a unit within the Department of Health whose only job is to combat this disinformation? And if you don't, maybe you ought to think about setting one up.
We have security people looking at this issue all the time.
What have you got to say about the pathetically low vaccination rates among Premier League footballers? Do you think there's a case for banning them from playing if they haven't had a vaccination?
Well, once again, I hope that they're listening and understand the importance of getting their vaccine. And
they clearly don't, do they?
My plea to them is, set an example. Lots of people follow these key football players, and in various issues, they are leaders in their field, and people listen to them. So set an example and get their vaccine and help protect themselves. And let's face it, if they do catch COVID, they won't be able to play. So protect themselves and show leadership with this.
But do you think the FA or the individual clubs should tell footballers that if you don't get a vaccine, you won't be playing?
I think I'll leave that up to the FA to make their own decision.
Vaccine passports, this is an argument that's gone on for many, many months. They are being implemented in Scotland and Wales, not in England. Given the high level of cases at the moment, do you think that there is now a case for the Department of Health in England to look at vaccine passports more seriously, particularly given the rise in cases?
Well, as the Prime Minister said and the Secretary of State, that we are on Plan A, and vaccine certification is not part of Plan A. And part of Plan A is to continue to build our wall of defence through the vaccines programme. And that's so important to do that, because that is really saving lives.
But when you talk about Plan A, which indicates that there must be a Plan B, the cases are rising, the hospitalisations are rising, the deaths are rising, admittedly not to the extent that they were in previous times. But how are you going to get the cases down? It can't just be left to the vaccination programme, can it?
Well, I think everybody's aware that we've got the autumn and winter plan, and part of that is plan A and part is plan B. So it'd be remiss of us not to have contingencies. But the data right now shows that plan A is where we need to be. And and we look at the data day in, day out, and that is showing that plan A is where we need to be with the vaccination programme.
There's various pieces in the Sunday papers today saying that working from home would be the most effective way of getting the case numbers down. At what point do you then start urging people to start working from home again? At 60,000 a day, 80,000 a day, 100,000 a day?
But the public have been very patient in doing what we've asked them to do. And I think Plan A has actually sort of opened up people's lives, and that's so important because because if we do need to take further measures, I'm sure they'll appreciate it, exactly the freedoms we've been able to offer them at this time. And the plan A is working. As I said, the data right now shows that plan A is working, and that's what we're sticking to.
It doesn't, does it? Because 3 or 4 weeks ago, cases were around 30,000 a day. They're now around 50,000 a day. Now, the health secretary said that they could go up to 100,000 a day. At what point do you decide that at least parts of Plan B need to be implemented?
Well, the Secretary of State was quite right in saying that the case rates could go up. But if you actually look at the case rates now and compare them to sort of early in the year, and then compare hospitalisations and deaths, we're in a very, very different place now. We've got our vaccine programme, the vaccines are working, vaccines are saving lives, vaccines are preventing hospitalisations. We've also got therapeutics. And as the Secretary of State announced just last week, there's new antivirals coming on board as well. So we've got a completely different picture across the country now as to when we didn't have the vaccine programme.
Now, according to the Mail on Sunday, some of your parliamentary colleagues are already questioning your suitability for the role and comparing you unfavourably with your predecessor, Nadhim Zahawi. One questioned why a former whip was picked for the role. Another complained that you don't have the show business presentational style of Nadhim Zahawi. Now, I'm not sure many people do, to be fair. But when you read these criticisms and the criticism that you haven't done any media interviews for 3 weeks, does that get to you?
I think, Iain, you know that as a politician, you've got to take the good things and the bad things. And I actually had 5 outings at the dispatch box this week. That was more than any other minister. So, I've been out and about and been busy talking to everybody. Yes, I do have a different style to Nadhim, but we are all different and we all bring different things to the table.